Biotone dual purpose massage cream.
Yeah.
I've got oil if you'd like for me to
Oh,
use
no,
instead.
whatever you use. I'm just,
Oh, yeah.
for the video, I'm just like, oh, what are you doing? And,
Yeah. Well, Biotone doesn't pay me or anything.
Right.
But yeah, it's
But
good.
then maybe there's a reason why you use that one.
Well, I mean, I just like the consistency of it, I think.
Yeah.
I really haven't used very many other creams. I guess I could find one I like more, but once I use that as an alternative to oil, I really think it's superior because the oil just gets kind of runny,
Mm-hmm.
and with the cream, I can just put like a little dab of it on my arm
Yeah.
and kind of have it at hand easily.
So you said you prefer no music, or are you just okay with no music?
I'm okay with no music.
Or you prefer music?
I guess so. I mean, it kind of depends. I'm so accustomed to it that it almost feels weird without it.
Yeah.
However, I like the negative space.
Yeah. I do like the friction that the cream allows you to do.
Oh, sorry. I just lost the thing that you had.
Oh, yeah, that thing wasn't working.
Yeah.
I'm sorry I forgot a hair thing.
That's okay. I have some things at my office that like Velcro.
Mm-hmm. Yeah, I have spa wraps.
Mm-hmm.
Is that what you have?
I guess that's what they're called.
But
But
pillowcase,
yeah,
but like a pillowcase works really well too.
Would you like one?
I think so.
Let's try that.
Yeah.
You might teach me something.
Okay, yeah.
I got plenty of pillowcases.
Yeah. So it doesn't work as well as the Velcro thing, but you just like use the weight of the pillowcase to just hold the hair up. Yeah.
And you're not gonna feel suffocated or anything.
Oh no, not at all.
I guess you wouldn't. Yeah, that makes sense.
Yeah.
Okay. Yeah, that makes a lot of sense.
Mhm.
But yeah, also the massage cream does have like a good glide to it.
Yeah.
At least the Biotone that I'm used to using.
And that's this one.
Mm-hmm.
Yeah.
benefited from the session I got from you.
Oh, good.
I really needed that.
I hope I didn't get here too late.
No, that's fine. Give me a little bit of time to tidy up.
Okay.
Sorry.
Um, I mean, it's all part of the experience. Like, whenever you mess with this, it actually like feels good. So.
Yeah, that makes
Yeah.
sense. Well, anything that doesn't feel good, please let me know.
Oh yeah. love what you do with the neck.
Oh yeah?
Yeah.
Anything in particular? I don't feel like I really focused on it that much. Not yet.
Well, what you've done so far is really good.
I'm glad. It means a lot coming from you.
Aw.
Yeah, you did really good work the other day.
So you've never had a camera on when you gave a massage?
I don't think so.
Yeah, it's I've done it several times. It takes a lot for me. I'm like finally used to it now, but it took a lot before I felt comfortable.
Mm-hmm.
So kudos, like thank you for letting me set it up.
Like, I did a little bit of work on one of my friends who was just trying to mentor me and like help me with my business. So she had another friend of hers that was like, they would just take photographs while I just did like little spot work on my friend's like neck and shoulder and stuff.
Oh yeah, didn't you tell me you were like posing?
Yeah, kind of.
Yeah.
So I didn't do a full session. I just kind of, you know.
Yeah. Just posing.
Yeah, just kind of got into the muscle enough to like work on some techniques and stuff, and you know, but it was like, you know, kind of mainly for pictures.
Yeah.
And I don't know, somehow I don't think that I ever want using them at all. I think the idea was I was going to put them on my website and then just
You should.
maybe I should really work on developing my website more.
Yeah.
I haven't changed it in a long time.
Well, I'd love to have a little.
Was I telling? Were we talking about it the other day? How I made it on Google Sites?
Yeah, you did.
Yeah, I thought Squarespace was the way to go, but Google Sites was free and it was like easier in my experience.
Yeah, we should have a little work session.
Yeah. I wonder if being filmed will make me like more conscious of things and like well, I could have used better body mechanics, you know.
Mm-hmm. Yeah,
I'm
having
sure
a
I can improve on that.
yeah, having a mirror helped me a lot.
Yeah.
Because then I can fix it in the moment. But with the video, it's kind of like too late.
Yeah. That makes sense. I
But
have
it
a
does-
tiny little mirror in my room.
Yeah, but it does make you just think about it, like the fact that someone's watching you.
Yeah.
had anyone give me that deep tissue on the hands or anywhere in so
Oh, yeah?
long. Like, this is so nice.
Sorry, my rug is bunching up.
Oh.
I have to readjust. Yeah, well, it must be because I know how valuable it can be. Yeah, my hands have been really messed up lately. But it's like a roller coaster. I mean, I'm feeling a lot better yesterday and today.
Are they hurting from doing massage?
Yeah, I think so. You know, I got a few people who are like CrossFit junkies, you know. Or not even that, it's just, you know, people that just like train really hard in what they do. Which is great. I mean, you know, I like working with people who are athletic and stuff.
Yeah.
But when they're like really thick with muscle,
Yeah.
sometimes like I don't work as smart as I should, you know.
Mm.
So I'm really, that's, you know, one of the reasons I'm excited about this Thai massage class I got coming up.
Yes. Yeah, I need to get that link.
Yeah, and I got some study materials from the last class I took from her. We can look over that. They're right
Okay.
over there. I think I lost that client who wanted to talk politics.
Oh, really? Oh, what happened?
She came back in on Tuesday for the last session in her pack
Yeah.
and was just like, there was a change in tone You know,
Really?
I mean, she smiled. She was polite and stuff.
Had you said something?
And I mean, I don't know. She might come back. Well, I think that like when she told me that Bernie Sanders and Obama belong in jail,
Yeah.
and like I kind of like clammed up, and I just kind of like I don't remember exactly what I said,
Yeah.
but I think that she could tell that like I was
Okay.
kind of freaked out, and
Yeah.
I don't remember what I said, but like just the fact that I just stopped talking and was like kind of staring at her and waiting for her to.
Yeah.
So I feel like I left enough of an impression. But she had one left session on her package deal, right?
Yeah.
And of course, you know, I mean, I didn't want to talk about politics with her, but she just kept, you know, like her session was supposed to start, and she was still like just.
And this is the last session? Like,
No. Well, this was like a week and a half ago,
Oh, okay.
and then she came in this past Tuesday for the last session. And I feel like she usually books the next one out, like by this time,
Yeah.
because she comes in every week.
Yeah.
Which, you know, I mean, I appreciate, but it's difficult when she wants to like, you know, lecture me about stuff for half an hour before a session.
Yeah. Yeah, you were so ready to be done.
Yeah. And she doesn't always talk about politics, but she always kind of drops some hints about it, and I was just, I don't know, she usually talks about her family and just, I don't know, their life, her and her husband. And I don't mind that, of course, but we're talking about, like, I can't get the session started, and we
Right.
should have, like, started, like, 20 minutes ago,
Right.
you know?
That's not good.
No. So, yeah, so she came in yesterday, this past Tuesday, you know, the first time since we had that awkward exchange about politics. And she just, like, she didn't start talking. She just, like, the tone was different,
Whoa.
so.
Wow.
And she wasn't rude. Honestly, like, she came across as kind of, like, sensitive and kind of, like, almost sad or something.
Oh. I swear I did not tell her anything.
You didn't tell? Oh.
I did not tell her you talked about her.
Oh, yeah.
That's so weird. It's like she knew.
Yeah, well, I mean, it makes me think that I probably gave her the right idea that, like,
Yeah.
she probably sensed how, like, bothered I was by it.
Yeah.
I'm trying to remember, have you had any kind of injuries to your, like, right shoulder or anything?
No, but I do have birth control sticks, like one in this
Oh, yeah.
bicep and one in this one.
Yeah,
And
that's
so
right.
that's what you might be kind of thinking about, like.
No, not really. I'm just thinking about how the shoulder blade is being held. It looks like there's a little bit more of a forward shoulder posture
Oh,
on the
really?
right side. A little bit.
Well, I'm right-handed. I do all my computer stuff.
Exactly.
So. And I do it on this day bed, so it's like a really bad.
Yeah.
Yeah.
Oh, no, you should get down off the table, man.
Oh, that's fine.
Yeah, that's fine with you?
Yeah.
Okay, maybe she can help then, right?
Yeah.
Oh yeah, I feel this thing.
So do you have clients come here?
Never. No.
Oh, okay.
Yeah, I just like to keep all my work in my office,
Yeah.
of course, unless it's somebody that I just know well. And I don't have to worry about disturbing this thing, do I?
A little bit, yeah.
Okay. I won't do any like hardcore like
Yeah.
Let me grab something
I'm really excited about tomorrow.
here. Yeah.
I'm trying to compile massage scenes that we can react to. But if I don't get that done, then I might just give you a massage, or we could give each other massages, because I'm happier with that than. I mean, I think it is good to have a video like that, and it's like impossible to do it with a tripod, and
To do what?
to get a good massage video like this.
Oh. Yeah. Impossible?
I mean, it's really hard.
Hmm. We're doing it now. Maybe I don't understand what you mean.
Well, it's hard to get good angles.
Yeah.
And get audio, and I only have the iPhone, whereas my friend, the videographer, has like a high quality camera.
Yeah.
So,
Well, that's really exciting
yeah.
to think about.
What would you rather do? Massaging or reacting to massage, like media, like how massage is shown in different TV shows?
Oh, I guess I hadn't really thought about that. That could be fun.
Yeah. And just our experiences as massage therapists. Like just sitting on a couch, just like talking about that.
um, yeah, that might be fun.
Yeah.
I might get really nervous and shy and stuff.
Yeah, me too. So I have another friend, a girl, who's like really open, and I think she would be good at like helping us talk. Like she might be a good interviewer,
Uh-huh.
you know?
Then not your videographer friend, or
No, he's not good at that. He's really not good at that at all.
sure.
Yeah.
I made friends with somebody recently who's like a life coach who kind of I'm excited about. You know, I don't know if I'm gonna like you know, I don't know if I need a life coach, but she was like making all these like affirmations. She was cutting out affirmations and giving them to everybody at the table and just like talking about things in a way that, yeah, I don't know. Seemed to have an influence on me.
Oh yeah.
Yeah. I guess I'm just like having all kinds of weird stuff to think about lately about like interesting conversations I'm having with my parents and my
Oh,
sister
really?
and yeah. Oh, and last night I went to go see my cousin perform at like an open mic night.
Yeah.
It wasn't actually my cousin, it was my cousin's child, who's trans, actually. I don't know if I told you about him,
Yeah.
the transition into a male or boy. And but he was performing last night at this like open mic thing where all the people in his high school were and stuff. So that was kind of exciting.
That's cool.
And like had a weird conversation with my dad on Father's Day and stuff like
Oh
that.
yeah.
So.
That's where we met up. I forgot it was Father's Day.
Was it Father's Day? That's
Yeah.
right. Yeah, it was. Well, I guess it was after that. after I left you?
I think so, yeah, because that's what you were talking about, you had to go do.
Yeah, that's right. Oh boy, yeah, he's kind of weird though.
What happened?
I don't know. I guess it was kind of like, at some point we got into like global warming and
Yeah.
about how like, the planet's gonna die someday, and making it sound like, well, like, we know that global warming is real. It's just that, we know that, man can't do anything to change it. We didn't cause it, and it's just gonna happen. So, there's nothing we can do to make it any better. And I was like wanting to argue with him, but it was Father's Day, and
Yeah.
I don't know. I just don't really like that kind of argument.
Yeah,
I mean, I don't know what to say to that,
me neither.
Like,
As individuals.
I guess we should just give up on our ecosystems that provide
Yeah.
food and just, keep on destroying the coral reefs, because, it's not gonna be here forever, so we may as well destroy it.
Right.
I just don't understand.
Yeah.
I'm gonna have to have a conversation with him about it later, but not on Father's Day. I don't know where that topic came from.
Oh, who knows, yeah.
We were just talking about this and that, and I think he had taken a picture of a flower, and we were talking about like, I don't remember where it came from.
Well, the flower is gonna die, just like the rest of the planet.
I guess. I was like, thanks for making me feel the doom and gloom, Dad.
Right.
It could be a lot worse. I mean, you got a decent relationship with him. So.
Yeah.
I'm getting turned around, confused in my routine.
No, just because of camera.
Maybe. Partially, I don't know. But it's fun. I need to get out of my usual way of doing things,
Or if you feel like it, yeah.
Yeah.
That's awesome.
Yeah. Yeah. Good. mean, I have. You know, sometimes things fall back in my YouTube algorithm and I forget about it, you know?
Yeah. Yeah, I haven't seen them in like a year at least.
Yeah, it's maybe stopped for I had a hiatus or something. Is this, is there, I feel like I saw something jump up right here just a
Really?
second ago. Yeah.
I don't feel anything right there.
I feel like like right here just seems to be a little bit more, like maybe there's a muscle there that's.
I don't know, but when you were going down the spine, it felt like somewhere around there. It it felt like my spine was like more tilted that way.
Really?
Does that make sense?
Tilted to your
Well, it
left?
felt like there was like you went over a bump that.
On this side?
Yeah, that it was like it wasn't straight. You know, it felt like one of my vertebrae was off to the side or something.
Okay.
But I don't know. It didn't hurt. It didn't feel like a tender spot.
That's pretty good.
But
I mean, you're pretty tough, I guess, aren't you? Like when it comes to pressure, you don't mind a long pressure.
oh no, I like pressure.
Yeah.
Except I do get a little careful about where my birth control sticks are.
Of course, yeah.
But-
I mean, I'll keep that in mind.
Yeah. But I love pressure.
Yeah, me too. Well, there's one massage therapist who I'd like to go back to, but he hurts me a little bit too much.
Yeah.
And maybe I want to go see him again because I feel like I need it in a way.
Yeah.
But I should just be a little bit more vocal about, like, you know, that's an 11. I'm on a
Yeah.
scale of 11 right now. You know? He does really good work.
Yeah, that feels like something. That feels
Mhm.
tender.
Mm-hmm.
Is that the spot that you were pointing out? before?
Yeah, yeah. Like, kind of right there. Is that it? Or did I miss it?
Yeah, actually, I feel it more there. You know, there's fewer nerve endings in your back.
Then your front? Or.
Than like your arms or your hands or whatever.
Really?
Like, yeah, the back just has fewer nerve endings, so it's harder to pinpoint like what
Oh,
you're
yeah.
feeling on your back.
Yeah, that makes sense. I kind of. That makes me want to compare that to, like, I remember in traditional Chinese medicine class, there was like, there are surfaces on the body that are yin and surfaces on the body that are yang.
That's
so,
a spot.
yeah, like right in here is.
Yeah, that's a
Yeah, it feels kind of like it's subluxated.
yeah.
Yeah. I mean, I'm no chiropractor. I don't know if I'm like really
Yeah.
authorized to diagnose that.
That's
but.
yeah, it does really. It's like the vertebrae's off to the side,
Mhm,
right?
mhm. Have you ever been to chiropractic regularly? I don't know if we've talked about that.
Yeah, not regularly, but I've definitely been to several.
I think it may have been like, hell, like 10 years or so since I've had a chiropractic adjustment.
Really.
You know, maybe I should check it out.
I think it's been like 3 or 4 years for me.
Yeah,
It feels great.
good. Yeah. on this hip in particular in the side lying position, I think.
Oh yeah.
Yeah. I just, the fuck around and find out
Yeah.
thing. Like, I guess my client fucked around and found out,
Yeah.
I'm sorry, I should not talk about or, focus on that right now.
I mean, she's been coming to you for a while, right?
Yeah, several months.
Yeah, so it's hard to just forget about something like that, like
Yeah.
an interaction you've had like so many times, and then for someone to just disappear.
Yeah. I mean, I feel bad for her in a way, because, like, I feel like we're making progress with her leg and stuff.
Yeah.
Because, like, she had really tight calves. And, like, she needs the work, I think,
Yeah.
I just couldn't take it anymore. I mean, it's not like I banned her. It's not like I kicked her out.
Right.
It's just that, like, I had to be honest about what she was preaching to me about.
Yeah. And you don't even know what you said, like, so you weren't even all that, like, confrontational about it.
Well, I mean, the reason that Bernie Sanders was brought up in the first place is that we were talking about the 2016 election and how, like, yeah, we didn't like either of our choices. And I was like, yeah, I didn't like either choice really. I was more of a Bernie Sanders guy. And then that's when she said, oh, well, Bernie Sanders belongs in jail. So.
So she should have known better.
Yeah. I mean, I was trying to avoid, I was trying to get her into my room so I could start working on her, but she wanted to talk about, just like conversations that she had with her neighbors and stuff that led to the political, like, why are we talking about all this?
Yeah. God, I hate that.
Yeah. And like another thing that she's always complained about is like all the churches, like they're Christian, but they don't like any of the churches around because they're like too whatever. And I'm like, I don't really care about that.
Right. It's almost like you could charge for like a talk session before your massage or after.
Yeah.
That's a good spot.
Mm-hmm. Good.
shoulders show up on camera.
Oh,
And
yeah?
he said this one is acting differently than this one. So I wonder how that would show up.
Mm-hmm. I mean, yeah, just I'm losing my terminology, but yeah, the shoulder blade is just trying to rotate forward, you know,
Okay.
like that.
Oh.
So I'd really like to, you know, try to open up the pecs and stuff
Oh,
when
okay.
I have you turn over.
Yeah.
And subscap, you know, hopefully that will help.
Yeah, or maybe I could do that.
Yeah, you know what? I could put this the bolster from my couch. If I can put that under your shoulder, that might help me like to really dig into
Okay.
subscap.
Yeah.
Is that comfy for you?
Yeah. that'll work.
Okay. Because I never really approach it this way, but I was going to work on it when I have you flip over. But this is good too.
And did you want to try your glasses, your cups?
Oh yeah. I really don't know where or like what to. They're right over here in a little bag.
Okay. Oh, that feels so good.
Does it?
Yeah. And I'll get my arm under it.
Oh yeah. Oh, sorry.
Okay. I like where you put the bolster. I always put it under the elbow, but this is cool.
I hope so. Yeah, not everybody could fit their shoulder up on it like that, you know?
Oh, that's true too. Yeah. This feels so good.
Sorry, I don't know how I might be clumsy doing that.
That's awesome.
But I'll be able to work on it a little more, but on a different angle when I have you inside lying. So I look forward to that.
Okay.
I like doing this too. I feel like it's opened up a lot more since last time I tried this little move. But I don't know if this feels as good as I think that it does. You know?
It doesn't feel as good as the other stuff, and that was a little bit painful too.
This is better than this.
Yeah, but
Yeah.
but it's getting to totally different muscles, so that feels good. But it's definitely more on the like ouchy side.
Oh, really?
Yeah. Ooh, that's nice. But yeah, it's getting stuff that's like never rubbed on. Oh, that's really nice.
Good. I don't know if that's a lat attachment or, I mean,
Yeah.
I'm a little bit lost in there.
Yeah, me too.
May have been lats, may have been Terry's.
That's so good. Oh my god.
Good. Yeah, it feels a little different from the other side.
Really?
And I'm not sure if that's just because I'm right-handed or because your hip is just held differently over here or what. But hopefully I'm getting, hopefully I'm able to get, more done on this side. Because it seems like this is the one that is a little bit more restricted.
Okay.
feel like usually maybe you do the same thing, but if a client tells me that the problem is in their right hip, I'm more likely to work on their left hip first. You
Oh,
know?
yeah.
Or for example, you know.
I don't do that just because I feel like the client would rather I wanna assess what's going on with where they're being bothered.
Yeah.
And I feel like it puts them more at ease to
To
know
know.
that I'm addressing their concern and I haven't like forgotten
Yeah,
what they
yeah.
said.
That makes sense.
And then I might like touch over on the opposite side to see if it's actually over there, but that's after hopefully I got them to trust me about what I'm doing.
Yeah. For some reason I got the idea, and like, you know, I mean, I always do it differently, and sometimes I'll go back and forth a couple times,
Yeah.
but I always got the idea somehow that like, it's good to see the side that's not affected first,
Oh, that too, yeah.
so that you can like kind of use that as a base.
Yeah.
But I mean, I don't know, yeah, once you assess what's going on, you should, it is important to let your client know that you didn't forget.
Yeah.
Yeah.
Have you ever massaged a butt that wasn't tight?
I don't know. They're all tight somewhere.
Right.
Yeah.
I think I want to say I've like one time, but yeah. Oh my gosh.
Mm-hmm. The QL stands out as kind of tight over here.
There you go.
Yeah.
Well, I think you're right because I think it's my QL that makes my low back sore.
Yeah.
But,
Oh, I just slipped off of the Erector spinating group.
oh my god, that feels so good.
Okay, good. You're okay?
Oh my god.
Yeah.
What the fuck? Yeah, you're doing like really great spinal work. My god.
Good.
Did you ever want to be a chiropractor?
I've thought about it, yeah, sure. But I'd have to go back and get a bachelor degree and stuff, you know?
Oh, really?
I think, maybe not. But I feel like chiropractic would be so much more, like, I don't know.
It is. I mean, it is a lot. I didn't know that they. I mean, I guess like everything, pretty much everything requires a bachelor's now. So I'm not surprised. Actually.
Yeah. I don't, well, not if you want to be a PTA. So that was an option that I was considering for a while, being a physical therapy assistant.
Yeah.
But to be a physical therapist, I mean, that's
Yeah,
a
that's a
doctorate.
lot,
So,
yeah.
I mean, I don't know. It's kind of unfair in a way, because I mean, I'm sure that there's a lot of physical therapists who do shitty work, and like, I mean, I don't know, not to toot my own horn too much, but like, I'm pretty sure that I help people more than a lot of chiropractors that are out there, you know?
Yeah.
I'm sure there's a lot of chiropractors that are, you know, do profoundly better work than I do, so, you know, in their field, so. And everything is case sensitive, you know?
Yeah.
But yeah, I'd like to pick up some chiropractic techniques. That would be fun. It's just too bad I couldn't really like legally practice it
Yeah.
without going to all that school. Maybe I should. Who knows?
Do you have to prepare the cups?
Oh, you know what? I should put the. The problem is that I don't really know how long to leave them on there or anything. So, and I don't know if I'm. I've never used them before, you know, other than just on myself a tiny bit.
Well, I know like one technique is to just move the cups around, and you don't just leave them sitting there.
Yeah. Is there anywhere in particular you think that I should try it first?
Wherever you would feel the most comfortable doing it. That's what I would
Sure.
say. Yeah.
Oh. Sorry, cat is in the way.
Oh, is he on the table?
No, I know.
Oh, he's just on the floor.
I stepped on her
Oh.
a little bit. Uh-oh, Amazon delivery.
Oh yeah.
I don't think it's for me.